NPTE Studycast.
Welcome to NPTE Studycast, Orthostatic Hypotension. That's a lot of syllables right there, Bridget.
You got it.
All right, we're taking a look inside OH. I'll just call it OH because it's shorter.
That's easier. Yeah.
What is it? Describe it briefly as students need to know it for the test.
It's just a decrease in your blood pressure by greater than or equal to 20 millimeters of mercury systolic, or greater than or equal to 10 millimeters of mercury diastolic when moving from a supine to an upright position. So it's just a drop in blood pressure.
Drop in blood pressure, 20 systolic, 10 diastolic. I could hear them doing that on the NPTE in some way, shape, or form.
Oh, yes.
That's the differentiator.
Causes.
So what's involved? What caused it? Who are we looking at with OH?
Yeah, so basically it's your cardiovascular system because it comes down to your blood pressure and supply of blood to the brain. So you want to keep in mind signs and symptoms. So your physical signs, if you're looking at your patient, they're going to have pallor, diaphoresis, potentially a loss of consciousness, and they're going to be reporting symptoms like dizziness, light-headedness, faintness, maybe even nausea.
Differential diagnosis.
What else could it be? Differential diagnosis if you're looking at a patient who appears to be giving symptoms of OH.
Yeah, so the first things I usually think of, and maybe this is my neuro bias, but I usually think of autonomic dysreflexia.
Yeah.
And that's where you're just going to really want to look at the BP, because with orthostatic hypotension, the BP is going to drop, whereas with AD, it's going to go up. But also you could think if people are reporting dizziness or lightheadedness, that maybe it's some sort of vertigo or BPPV, or maybe just generalized nausea from infection or something like that.
So I always remember that hypotension blood pressure drop, and then autonomic dysreflexia, bringing that in. That's the blood pressure is going to increase.
Special tests.
Special tests, or how do you look into this?
The biggest thing that we can do as PTs is just orthostatic testing, where you're going to be monitoring somebody's BP with position changes, and that's just going to help you with ruling out something like a vertigo or a BPPV. If you're able to monitor their blood pressure while they're changing positions and you see that it drops, then you know right away that that's what it is versus something else.
Treatment examples.
All right, now once you've got it locked down to OH, what does a PT do about it? What are some treatment examples?
Immediately or urgently, you're going to lay the person down and elevate their legs just to prevent any kind of loss of consciousness. But then after the episode resolves, you're going to want to talk to the treatment team about what kind of BP meds they're on. So they might be over-medicated or getting too many blood pressure meds. With the patient, you're going to want to encourage a lot of fluids, and then you're going to want to progress and decrease their orthostatic episodes. So you want to progress their upright tolerance time. So you can use like a tilt table, you can use the hospital bed functions, elevating the head of the bed, and then you can use things like abdominal binders or even ACE wraps on their legs to kind of help keep their blood pressure at a normal level.
Lay down, feet up. That's the thing I took away from that. Yeah, got it.
Here's your example question.
How are you going to look at it on the NPTE? How will this come into play?
The important thing is a PT's ability to recognize OH and then manage it. So they might give you kind of a more emergent scenario where you'd have to decide that it's orthostatic hypotension and then what you would do about it, and then possibly differentiating between orthostasis and something more serious.
All right, orthostatic hypotension. A lot of syllables, but now you're covered.
But pretty simple.
That's it. Got it.
Yeah.
NPTE Studycast. Brewed by the PT Pintcast.